prescription hearing aids. Coming up. Episode of the Dr. Cliff Show. I am Dr. Cliff Olson, founder of Applied Hearing Solutions in Phoenix, Arizona, and I am here with my co-host.
Hello. My name is Dr. Rachel Cook. I'm also an audiologist at Applied Hearing Solutions. Thanks everyone for tuning back in today. We're happy to have you. Today's episode, we are going to be running through all about prescription hearing aids, like you said. So last week was a rundown about OTC hearing aids. This week will be a rundown about prescription hearing aids. And next week will be kind of a battle between the two, if you will. Just kind of main similarities and differences between the two. And so today in our opening segment, we're going to cover the basics, kind of who are they for, what are they, brands, styles, technology levels, things like that. A real basic overview of hearing aids overall. And after we do our Hearing Up Spotlight with Dr. Al Turi, we will dive into kind of how a prescription hearing aid is used to treat hearing loss and what to expect out of your hearing professional when you are being fit with a prescription hearing aid.
Absolutely. All right. But before we get into it, let's go ahead and get into our first sponsor. As you guys know, sponsors really help us be able to produce this show. So the first sponsor that we're going to be sharing today is Esco. Now, Esco specializes in providing insurance coverage for your hearing aids. Now, I don't know, Dr. Cook, but dogs love hearing aids probably as much as we love hearing aids. Mm-hmm. And there are certain dogs that love the smell of their owner's devices so much that they actually want to chew them up. Now, if you guys are listening to me on the podcast, you can't see this, but I am holding up a hearing aid that has been chewed to bits by a dog. Now, this is not a problem if you have in-warranty coverage and loss and damage with your devices. But if your dog chews up your hearing aids one time, you can file your loss and damage claim with your hearing aid manufacturer, but you can only do it one time. So if this happens again, essentially you are up a creek. Like there's nothing you can do. You have to buy a new set of hearing aids unless you actually have an in-warranty coverage option from Esco. So you can actually get your insurance reinstated, your loss and damage insurance reinstated for your devices. So if your dog loves you so much that they want to chew up your hearing aids a second time, you can actually get them covered. Now, if you go to esco.com, that's esco.com/Dr. Cliff, Dr. Cliff Show viewers will get a $10 Visa gift card just for registering your hearing aids on their website, and Esco will even send you a reminder when your hearing aid warranty is about to expire.
This is true. We love Esco. So, jumping straight on in here. Who are prescription hearing aids for? Prescription hearing aids are different from OTC hearing aids in that they can be fit across the lifespan. What is the age of the oldest patient you have ever worked with?
104 years old.
104? I got you beat. 106.
106? Yeah. Oh my gosh. Well, I don't know. I might catch up to you. But yeah, so I mean, when you look at prescription level hearing aids, they're generally wielded by a hearing care professional, and a hearing care professional may specialize in newborns, might be specializing in, toddlers, or, someone who is, more age-related hearing loss, maybe in their 40s, 50s, 60s, and then you might have someone who specializes more in the geriatric population specifically.
Yeah.
So prescription level hearing aids can be used for a wide range of individuals and age groups.
For sure. Also, hearing loss types and severities, too. So pretty much 9 out of 10 hearing losses can be treated by the use of hearing aids. And a lot of people don't know that, right? So their first stop when they have a hearing issue, they go to the ENT and they say, hey, can you get this fixed for me? And a lot of times the ENT has to say, actually, I can't do anything about this. This is not a physical issue. This is a physiological issue deep within the inner ear, and you need to proceed with hearing aids. But sometimes hearing aids can also work for those physical hearing losses as well. So conductive hearing losses. I actually just had a patient this week who had a fully conductive hearing loss but wasn't ready for the surgical intervention and decided to move forward with hearing aids as a first step. for her. So that's a possibility as well.
And even in that case, they could potentially go through surgical intervention, clear up whatever that component was from a medical standpoint, and then ultimately go with hearing aids after that. So, when you really start boiling it down to numbers, I mean, the vast majority of individuals who have hearing difficulty are going to be getting hearing aids, right? And whether it's a prescription level hearing aid or an OTC, and we talked last week, if you guys missed the podcast last week, go check it out. It's on the YouTube channel, it's on Facebook, it's on all of the podcast platforms out there where we talked about OTC. But, when you start looking at prescription level hearing aids, there's no restriction on, any type of hearing loss, basically, when you look at it that way. So, but there's also asymmetrical hearing losses. A lot of people don't realize that if you are deaf in one ear, and then you have even normal hearing in the opposite side ear, there's prescriptive level devices that actually treat that type of hearing loss, and almost nobody knows about that type of hearing loss.
Right. And when you have a single-sided deafness or a unilateral hearing loss, those can still be just as debilitating. Like, some people will say, like, oh, well, I still have a completely normal hearing ear, and that does a lot of the heavy lifting. But the listening fatigue that comes from that is significant. And so we have prescription level hearing aids that are able to accommodate those types of hearing losses as well.
For sure. And then, that we're not even considering tinnitus here yet, but, there's studies out there that show that 6 out of every 10 individuals who have ringing in the ears, tinnitus, tinnitus, however you want to call it, actually receive benefit from the use of hearing aids, because you're replacing the missing sounds that often triggers that perception of the ringing and buzzing inside of your head.
And even if there isn't a hearing loss there, very often, if someone has tinnitus that cannot be corrected through the use of sound generators in general, or just adding sound enrichment to their environments, they are still able to be utilized in many instances as what we call ear level sound generators. So instead of having something that you're taking around with you from place to place, these would be sound generators that would be worn like hearing aids at the ear level. And when they're there, they are providing, background sounds of white noise, pink noise, rain falling, gravel, walking on gravel, things like that. But things to add a little bit of extra sound conditioning to that environment.
That's right. It makes it more tolerable to deal with your tinnitus when you have those things going on. And then something that I know that we'll talk about this in episodes down the road, but individuals with auditory processing disorder. So there's a lot of individuals out there that even if they are getting a certain amount of sound, an appropriate amount of sound, they still have difficulty putting it together. But there are also individuals who have a little bit of auditory processing disorder that gain benefit from having additional amplification, and specific amplification set up in a very particular way for that. So that's very important to understand, and that's one of these things with, no matter what type of hearing loss, no matter what severity of hearing loss that you have, prescriptive level hearing aids can hit the full range.
The full range. There's nothing we can't touch there. So. And there's also several different brands that manufacture prescription hearing aids. So why don't you talk us through some of those?
Yep. So you have what we call the big 6, the big 5. They've been consolidating a little bit more as time has gone on. We have companies like ReSound, who is one of our sponsors of this show. But you've got other great manufacturers out there as well. You have Signia, Widex, Starkey, Phonak, Oticon. I know, speaking from my own personal experience, I've worked with every single one of these brands. They're all very reputable brands, and these are the ones that have the lion's share of the market. And it's really, from a prescriptive standpoint, if you're going to get a hearing aid that's made by a manufacturer, or you need a prescriptive level hearing aid, you want to make sure that you're getting one of them from a reputable company. Right.
I think we have a graphic as well for the specific market penetration of each brand, and that'll be up on the screen now. So different brands have a different percentage of the market share in this country. This is going to be a global market share graph as well, and so you can just kind of see a little bit of the breakdown. Now, I don't necessarily think that has anything to do with, or it might have a little bit to do with, performance of the brands, but overall I just think it's about where are they even selling and things like that. So that doesn't mean that just because it's lower on the list
if you're if your name is up on that screen, you're a reputable company who's creating good quality products. Right? Yeah. And you probably saw Sonova up there, you saw Demont up there, you saw GN up there. It's important to understand that each one of these brands have multiple brands that are inside of them. So when you look at a company, Sonova, company like Sonova at 31% market share, they actually have that combined with Unitron, which is one of their brands. Phonak is one of their brands. Hansaton is one of their brands. They even own Advanced Bionics, which is a cochlear implant company. When you start looking at Demont, you're starting to look at companies like Oticon and Bernafon, I believe, is underneath that umbrella of a company. All of those good quality products, right? And then when you start looking at a company like GN, they have ReSound under them. And then they also have a consumer electronics company named Jabra, but now that company is starting to come out with hearing aids type products, right? Like self-fitting devices.
So I think this landscape is going to continue changing. Someone once posted this graphic that had every single hearing aid brand style offering on one graph, and that is just going to continue moving around as companies continue combining or turning into these sister companies and things like that under the same umbrella.
For sure.
But I think that it's definitely important to know that each of these hearing aid companies, they might have different style offerings, they might have different features within them, they might have, I mean, overall, they're working as a prescriptive level hearing aid, but there's differences, tiny differences and nuances between each of them that separate them out.
And we'll talk about those later because, you know, it's really important that if you have a certain type of hearing loss or there's certain things that you want to do that someone else might not want to do, that you need to make sure that you have the right device to be able to do it.
Right.
And with a combination of one of those brands that we had just mentioned, you're going to be able to find the solution that you're looking for if you go to a hearing care professional who is rock solid in their understanding of each one of those brands.
Definitely. Now we got a bunch of different styles of hearing aids as well, and like I was saying, some brands offer different style options. But let's start out with kind of the oldest, most long-standing hearing aid in the lineup that can also treat the widest range of hearing losses as well, which would just be a standard BTE or a behind-the-ear hearing aid. And that's going to be one that's worn, of course, behind the ear. And those ones have tubing that comes down from them.
Like a thick tube that sound actually travels through.
Right.
As opposed to the ones that have a wire, which have the lions of the market share today.
For sure.
I don't know, I can't remember the last number I saw, probably 80% or more of the market is individuals who use a receiver in canal hearing aid, which is still goes behind the ear, so that's kind of like where the misunderstanding happens a little bit, but a wire that comes down on the front side of your ear from a device that's on behind your ear and then has either a dome or a custom ear mold that goes inside of your ear canal as well. But you know, I really feel like in the ear or in the canal style devices are making a comeback a little bit, don't you?
I do, definitely. Especially now that many of the brands are offering rechargeability, Bluetooth capabilities. Beforehand, because everything was packed into such a small device, they were really, really limited in their functionality in that aspect. Now what we're seeing is they're coming up with these accommodations. They're Bluetooth to the phone now. They are rechargeable. And we're just going to see all of those components and features continue to be packed into smaller and smaller and smaller spaces so that those devices can get deeper and deeper in there.
You know, when we start looking at, you know, where the money is being spent inside of the hearing aid industry, a lot of people talk about the cost of prescriptive hearing aids, but a lot of that money is being put into research and development, and that's how they're able to get all these different styles of devices with all these new features that are coming out like crazy. And I do think that we should gently touch base on the use of lyric hearing aids, which is a totally different style of hearing aid that is not permanently, it is placed inside of your ear canal approximately 4 millimeters away from your eardrum, and it stays there for 2 months at a time, only to have it swapped out by your hearing care professional 2 months after that.
Swapped out 3 of them today.
Yeah, there you go, right? And then you have companies like EarLens, which is extremely unique. We won't get into that here today, but I do have several review videos of EarLens on my channel. And then you have bone-anchored devices for conductive hearing losses, as well as cochlear implants, which is a surgical option as well that you can treat hearing loss. Technology levels, I mean, every manufacturer has a variety of different technology levels that you can choose from. I always tell all of my patients that you go with the highest level of technology that you can reasonably afford. If you cannot afford it, that is the reason you should be dropping down in technology level, and then it is the job of your hearing care professional to optimize the performance of those devices, because each time you do drop down, it takes features and customizations away from us when we're trying to make that prescriptive level hearing aid do its job.
Correct. Yep.
So we do have, now is a good time to talk about our other sponsor, and when I was thinking about it when you were talking about using tinnitus maskers.
Yes. So another one of our sponsors here is going to be Sound Oasis. Now, between 10 and 15% of the population actually struggles with the perception of tinnitus, and most of the time, a large majority of patients are able to kind of tune that out during the day, especially when they're doing things in their day-to-day. They're going to work, they're engaging with family, but a lot of people really struggle with the nighttime aspect of things where it gets super quiet and then that tinnitus starts creeping up again. So Sound Oasis has an entire line of different sound generator products. Each of them has a different amount of specially customized noises and background sounds to help decrease the perception of tinnitus, especially for those quieter environments, maybe times when you're reading, working, or even trying to sleep. The one that I have in front of me right now, they even have things like pillow speakers, which is really nice too. If you want to use a sound generator at night, but you have a partner who maybe does not want to use a sound generator at night, those are awesome because they slide right into your pillow, and so then that sound generator is being sent directly to you, which is awesome. So sound generators, I recommend them to anyone who has tinnitus, and Sound Oasis has got a product and has got a solution for you on that one. They have even supplied us with a promo code as well, and if you use the code SLEEP at soundoasis.com, you can get 20% off of your purchase of any of their sound generator products.
That is awesome. All right, so it's now time for us to actually get into our Hearing Up Provider Spotlight. Now, if you guys do not know what Hearing Up is yet, then you've not been watching the podcast, and shame on you. But Hearing Up is a network of hearing care professionals that have been vetted by me to make sure that they're actually following comprehensive best practices. Best practices are those things that your hearing care professional can do to optimize the performance of your hearing aids. Now, who do we have as our Hearing Up provider today?
Today we have got Dr. Al Turry. Dr. Turry received his Master's of Science in Audiology from the University of South Florida in 2001, and then went on to receive his doctorate from, is it pronounced Salus University?
Salus, you got
Salus
it.
University in 2006. Dr. Turry's been practicing for 20 years, and in addition to his doctorate, he's also gained all these other certifications over this time. He has become a certified dementia practitioner, as well as a certified health coach. And this has also led to securing a seat on the Cogniview Clinical Advisory Board, which is so cool. And we'll obviously hear more about that here in a moment, because cognition and hearing, they go hand in hand. Dr. Turry practices at the Villages Health System in the Villages, Florida, and is the director of audiology there. So definitely a warm welcome to Dr. Al Turry.
Thanks for having me. Nice
to meet you. Nice to see you.
So Al, fill us in. I mean, you've been one of the leaders in looking at, cognition and hearing, and actually administering a lot of cognitive screening and testing inside of your clinics. And if I recall correctly, the Villages Health System is the health system for like the largest retirement community in the entire world. Is that correct?
Yeah, that's correct. 150,000 retired. About 70,000 golf. And we have 9 doctor audiology areas health system can serve that population.
So what can you tell the listeners and the viewers about how hearing loss impacts cognition and maybe vice versa?
Oh wow. How many hours have?
Yeah. Yeah, you got about 6 minutes, so.
Listen, the elevator, the short version of this, over decades of research and clinical application, we now know the hearing process is not peripheral, don't amplify, make it loud. The impact of change also impact out education. So from us, for other providers like us, first and foremost, screening is the identification. so that we can get those patients back to their doctor, additional testing, and then time of changing their style, slowing down progression without modification, and maybe a pill comes out free for some type of treatment. And then the part of the same process, hearing loss, using best practices now that untreated hearing loss leads to structures of the brain. If we treat hearing loss, research that's been published, hearing treated with best practice, structures of the brain, functional MRIs showed that the temporal lobe started to go again, right? As opposed to the occipital lobe for these models. Way too detailed, but the point is, untreated hearing loss in the cognitive system is by no means a silver have dementia, growing body of that it's the number of risk factor that progress and leads to reduced social isolation. And most importantly, I think cognitive load is reduced. Your hearing loss, they communicate with less effort, less cognitive load in settings, and that's the huge benefit, right? That cognitive other thing. That answer your question, Cliff?
It does, yeah. That's fantastic. I know that you're on the board with Cognivue. Cognivue has really taken, really, I would say, the leading step inside of not only hearing care, but they're looking at all these other different professions that are on the front lines with individuals dealing with cognitive, loss and dementia concerns and all of that. So talk to us a little bit about, Cognivue and what that actually does and why you might actually find that inside of your hearing care professional's office.
Yeah, I hope you see office. Every audiology office. I'm a big advocate. I've been screening since 2016 using paper and pencil batteries. I love cognitive. I've did beta tested cognitive devices between paper and art, and there's just nothing better than Cognivue. Why should it? Everyone's hearing health. We're on the front lines. We have to screen and identify patients that aren't even have concerns. Fail the screening test. Get them back to their primary. Serious conversation about things to reduce their risk. Further testing to identify cognitive impairment. So that's why I think it's important. Not so much. I think that information part of my plan is important. Testing them again, actually able to help memory. That's awesome. Great. The benefit here is the people in our office that aren't having this conversation are now being identified. I just had a patient, a couple came in for his 4-month check. They cognitive again, see how he did after treating his. Gave me a big hug and told me, I said, based on the comorbidity gave him along with his cognitive, he went back to his primary care. The PCP ordered additional, they identified life threat, put him on medication. If you hadn't brought this to my attention, you would have died. So that's pretty darn cool.
Absolutely. I mean, I often think about what, we do in the hearing care world. I mean, we keep people connected to other people, which is hugely important for longevity and all the things that you mentioned earlier, in terms of isolation, depression, there's increased risk of falls. I don't think people realize how many other things crop up from the hearing loss. And, the population of individuals that typically would need prescriptive level hearing aids are the ones who are kind of in that range of individuals who might have concerns for cognition, and it's really hard for them to identify it until it's too late a lot of the time.
So true. And another beauty of having 5-minute cognitive screener, like cognitive view in your arm. It takes very little time. It's easy. As long as you've got some vision, you can take. There's just no reason, my opinion.
Yeah, no, I agree. So, Al, we really appreciate you coming on here. We think that this discussion of, hearing loss and cognition, and then, treating the hearing loss with a prescriptive level hearing aid in order to potentially stave off the negative effects of, auditory deprivation and all of that is probably worth having you come out here to Arizona and having us have an entire session with you. But we appreciate you taking some time out of your busy schedule there today. I know you're out there on the East Coast. It's probably well past your dinner time at this point. It's probably time for you to go home.
Yes, I do. You and all you're doing, network. We love all that you're doing for the people and want the quality care. Thank you.
Awesome. Thank you, Dr. Turre. I appreciate you.
Thank you.
All right. So I think Dr. Al Turre is a fantastic individual in our profession. There is a lot of concern out there that maybe hearing care professionals don't belong in this role of identifying potential cognitive issues. But just like he said, I mean, there are a lot of individuals out there that have some concern from a cognitive standpoint, and if we don't identify it, there's potentially people slipping through the cracks on that.
For sure. And I think hearing care professionals are doing testing specifically on auditory processing. We're doing word recognition testing in quiet and in background noise. We can see when processing deficits start to pop up, and we can also, we're seeing these patients so many times throughout the year. We're seeing them far more often most of the time than their primary care physicians might even be seeing them. And so I think we're very tuned into these differences in behavior and just communication and in everything. And so I think it is important to be aware of the role of cognition in this and referring when appropriate, and screening and then referring when appropriate.
Absolutely. So. And it's really backed by data. I mean, he was mentioning some of that earlier, is that it is a leading potentially modifiable risk factor for dementia later in life, and that is hearing loss.
Yep.
The number one potentially modifiable risk factor.
Right.
So with that said, really appreciate Dr. Al Turre coming on today for the Hearing Up Provider Spotlight. But we've got another sponsor that we want to share right now, and that is ReSound. So ReSound is one of our sponsors here for the show, and today I'm going to be talking about their Customs by ReSound. Now, from an aesthetic standpoint, I'm in love with these guys because these are by far the best looking in-the-ear devices that are out there. Now, you can tell that they've been inspired by Jabra, and Jabra being kind of on the front line, it's a sister company of ReSound. So, and then they are also owned by GN, like I mentioned earlier. Now, you can do pretty much anything that you want to do with this hearing aid. You can stream audio into it. You can wear it comfortably all day long. You can plug it into your charger base and recharge it, so you don't have to change batteries. So there is a lot of cool things that you can do with these devices here. So if you guys are watching, I do recommend you actually watch this podcast instead of listening to it, but you get to see them here on the camera, and I'm actually going to put one in my ear while I've got it here, and let me get the right one because I have my earpiece in the other one, but here we go. And you can't tell me that that is not the coolest looking hearing aid that goes in the ear that you've ever seen. Nice size push button right there to make programming or volume adjustments and things like that. So if you are looking to potentially break the mold, so to speak, not literally, or otherwise you might need Esco, right?
Yeah, yes.
But you can go custom and still get all the same great features that you can get inside of a receiver and canal hearing aid. And they just came out with an even smaller version of that. So if you do want it smaller, you can get completely in the canal.
Nice.
Make sure you check out my review if you want to learn more about the Customs by ReSound hearing aid.
Yeah, those are pretty awesome. Every company is probably going to be moving towards getting a custom version that looks a little bit more like a headphone, and that is definitely one of the better looking ones that I have seen, that's for sure.
For sure. I think that there's going to be individuals who don't even need hearing aids that would wear a product like that because it's cool and you can stream, and it's just crazy.
Yeah. It's definitely going to help bring hearing aids to more people who need them, kind of breaking some of those barriers down and some of the stigma associated with aging and things like that. So I'm so happy to see a company that is putting that forward.
So now when you say who needs them, how do we know who needs a prescriptive level hearing aid?
Well, we determine that through a comprehensive hearing evaluation, and that ends up resulting in something called an audiogram. And we can pop one of those up on the screen here. An audiogram is basically a visual map of your hearing loss, and it allows us to determine the type of hearing loss, the severity of the hearing loss, the symmetry or the asymmetry between the ears. There's a whole bunch of information on there, kind of just pointing to what type of hearing aid would you even be a candidate for, and also indicators of how well you would do with hearing aids from a prognosis standpoint as well.
Yeah, when we look at the audiogram that's up here, in order to get all of the information that's on this current audiogram, it can take up to, 45 minutes depending on the individual. But, you've got the thresholds we have to find out, how well you hear in background noise. We got to find out what your uncomfortable listening levels are. Sometimes tympanometry is required to see what's going on in your middle ear space, acoustic reflexes to determine how well the auditory nerves and all of that are working as well. And then, like you mentioned, word recognition capability. I mean, if you don't have good word recognition capability, then your prognosis for success declines, like you were mentioning. Now, when you have an audiogram like this, you start to identify, okay, what device is most appropriate for this individual. And I know we just got done talking about the style of the in-the-ear hearing aid with the Customs by ReSound, but style matters when it comes down to treating a hearing loss.
It does. Yeah, you're not going to be a candidate for certain styles of hearing aids depending on the type and severity of your hearing loss. And so sometimes I do have to break patients' hearts and say, I know you want this really, really tiny little microscopic hearing aid that goes all the way deep down in there, but unfortunately your hearing loss has a power requirement that cannot be accommodated in a device of that size.
Right, and on top of that, if someone's like, I really want a small device, but I also want to do Bluetooth streaming directly into both of my ears, it's like, well, hold on, that device is not actually big enough to hold a Bluetooth antenna inside of it. So you're going to have to make a concession and actually go larger on the device, or go with a device a receiver and canal that goes behind your ear that allows you to get all the Bluetooth capabilities that you want, and you still can't see it. So, it's just a lot of what we do when we have an audiogram in front of us is that we are taking what the patient's wants and needs are, and we are determining the exact right device from a style standpoint, from a how much amplification it can create standpoint, and then all of the other things that you can tie into a hearing aid, like an assistive listening device.
Absolutely. Wants and needs, like you just said, I mean, that's a huge part of it, and I think a large majority of the time when we are determining what type of device a patient is a candidate for, what we really have to take into account is, what are they looking to get out of this device? And for some people, that's going to be a durable device that's easy to use, and we can do that. For other people, they are super tech savvy, and they want all of the adjustments, all of the Bluetooth, all of the connectivity, and again, that's going to be a completely different device. In fact, a full 180 device, because some devices are super techy and they've got just a million customizations and adjustments that the patient can make, and I'd show that to some patients and they'd go, oh, that sounds awful. I want the easiest type of thing you can get me into. So it's really important to take into account, are they working? What are their hobbies? Who are they trying to hear? What is the purpose of moving forward with hearing treatment? What are they trying to gain out of hearing treatment? And so patients should be seeing a provider that's taking these wants and needs and different parts of their lifestyle and putting that into the determination for what device they move forward with.
And this is called person-centered care.
Yes.
I mean, taking the time to understand the wants, needs, and values of an individual who comes in so you can specifically understand what they want, so you can then go and match them up with the exact right hearing aid for them. I don't know how many patients come in, and it's probably because of our clinic and people see videos and get all excited about a certain hearing aid, and they come in and like, well, to do all the things that you actually want to do, that is probably the worst hearing aid for you, and we need to go with this completely different device, but we can still get you all the things that you want, right?
Right. So seeing a professional, knowing what brands that professional is comfortable with is also huge, because the features and customizations, you really want to be seeing someone who's comfortable fitting that product and who fits that product pretty regularly. Not to say that they can't do it, anyone can do it. Any hearing care professional can do it, rather. But it's important to know what their brand familiarity is from a feature standpoint, and overall, it's important to know what features that device is going to have. Does it have Bluetooth? Does it have GPS? Does it have assistive technology or assistive listening devices, like you said before, that it's compatible with? And so taking that entire
And you're an audiologist in our clinic, and that's kind of what we pay you to know.
Yes.
Is all of that stuff, right?
Yes, correct.
And so when someone asks the question, why is a provider needed for a prescriptive level hearing aid, like what type of things would you say?
Oh, goodness. Well, the complexity of the testing that is included into that. So if we walk through a hearing evaluation that we do at our office, it's going to result in the audiogram that you see on the screen there, where we're testing your response to tones, we're testing your response to words, we're testing your response to words in quiet and in background noise. We're doing several tests. If there's pressure concerns or fullness concerns, we're able to test out the pressure of your middle ear space and make sure that everything's looking good in there. We're looking in your ears, and we're making sure that there's nothing in there that needs to be taken out that's impacting your hearing as well. So the complexity of the hearing test is a big component of that, for sure. But also selecting the proper hearing aid features, that's a pretty big one too.
Absolutely. I think a lot of it comes down to the features. So knowing how to do the testing, knowing which features are in which hearing aids so you can select the right device, but then actually setting them up the right way too. I think that a lot of people get lost in this idea that just because you have a feature inside of a hearing aid doesn't mean that it's actually being implemented correctly. And I even think that we need to talk about technology levels here, because I think a lot of people assume that, well, if I just get the best hearing aid from a tech level standpoint, that one's just going to function way better. And oftentimes that cannot be true if the hearing aid has not been optimized appropriately.
Yep.
And then you take it another level further, you have someone who might say, I don't need the hearing aid with all the bells and whistles, right? I just want whatever the entry level, lowest technology level is, because, I don't think I need those things, because I don't go out and do a whole lot of things, or I don't want to have to fiddle and mess with stuff. And what people don't realize is that every time you go down in technology level, you are taking away a lot of the automatic functionality of a hearing aid, and it takes someone who is not tech savvy at all, and it requires them to be tech savvy if you don't have a device that can do things automatically for you.
Yep, absolutely. And another component of this too, and you actually just came out with a video on this as well, but the proper physical fit of these devices is huge. Sometimes it takes a lot of training to learn how to insert and remove these devices, and it's definitely made easier by a professional that can help coach you through that. But making sure that the acoustic coupling to the hearing aid itself is actually the correct piece that is going to be able to help the hearing aid deliver the amount of sound where you need it and how much you need. If you don't have the right piece on the end of that hearing aid, you are also out of luck. It doesn't matter if you have the highest level technology device. If you do not have the proper acoustic coupling on that device and the proper programming of it, you might as well.
Absolutely. I'm actually going to bring up my mother here. My mom would be okay. So my mom, Terry Ann, who's in Illinois, I'm not violating HIPAA, am I? I don't know. It's my mother. So she actually wears hearing aids that have, and you say acoustic coupling, but in this particular case with her, we use a rubber dome inside of her ear. For her type of hearing loss, it just made way more sense to use a rubber dome. There are patients, and we saw several today, who, if you try to fit them with a rubber dome on their really nice hearing aids, they will have a horrible experience from a hearing standpoint. So it's very important, like you said, the acoustic coupling is paramount. You can bring an expensive prescriptive level hearing aid to its knees if you select the wrong 50-cent piece that goes on the tip of the hearing aid.
And unfortunately, we see it. So it is huge to see a provider who follows best practices and who is going to be taking the steps to verify and validate at every step of the way that the device that was selected for you is a correct device, that the technology level is accommodating your lifestyle, that it's doing all of the things that you set out for it to do in the first place.
So how do we know if a hearing aid is going to be set up the right way?
We can verify that.
We can verify that.
We've got the technology for this. So we have several ways and software systems where we are able to conduct real ear measurements to verify that the hearing aid that we have selected and the acoustic coupling that we've got onto that hearing aid are going to appropriately deliver the amount of volume that that patient needs and exactly where that patient needs it.
I don't think a lot of people realize that outcomes with hearing aids is highly predictable. Right, I think a lot of people assume that, like, oh well, I'm going to try this hearing aid or try that hearing aid or go try a different provider and just kind of see what happens. It's like, you don't have to try. Like, you can predict an outcome, and the way that you do that is you go to a provider who follows best practices. It's a long list of different things that need to be done to make sure that a hearing aid actually performs the right way. And if you go to a hearing care professional who follows comprehensive best practices and they do your testing and they say, okay, you have 96% word recognition ability in both of your ears with a very low speech and noise score. When I fit you with hearing aids to this prescriptive target level, you are going to have success, massive success with hearing aids.
Yeah,
right?
You can say that definitively.
Definitively.
Yeah.
All right, and only on very rare occasions where a patient does not comply with the appropriate sequence of events that they have to go through to adapt to technology, do things go wrong.
Right.
So best practices are absolutely paramount.
That they are. Let's move into our last sponsor segment here. We have got Eocera. Eocera's got an entire comprehensive line of ear care products. In fact, a lot of their earwax products, earwax removal products, we use it in office. It is great at removing that stubborn, tricky wax that just will not get out of the ear canal. But in addition to that, they have an entire line of products. They've got Earwax MD, they've got Ear Itch MD, and they've also got Ear Pain MD. And we've touched on the first two a couple of times, but Ear Pain MD is also in that lineup as well. Ear Pain MD has a mixture of lidocaine and aloe in there, and several other things. But those two really help to soothe those canals that might be having those ear canals that might be having a little bit of pain or irritation in there for whatever reason. If you've got any sort of earwax concerns, ear pain concerns, ear itch concerns, it's always good to see a professional at some point, but a lot of times those appointments, they're booked out forever. So you need something in the interim, and Eocera has got what you need there. So if you visit their website as well, they have been kind enough to provide us with a promo code. We've got the code CLIFF20, and that'll get you 20% off any of the products that you choose to purchase from their website.
Awesome. Thank you, Eocera.
Thank you.
We are moving right into our Q&A session here. And so we have our resident audiologist, Kelsey Beck, here with us again today. She was a fan favorite from last week, so we decided, well, hey, we'll just bring her back. So here we go.
Well, thank you for having me back, and thank you everybody for giving us all of your questions, and we are going to go ahead and answer a few of them.
Cool.
The first one that I wanted to bring up is, are Costco hearing aids prescription hearing aids, or is there a difference?
I'm going to let you take that one.
Okay.
You've done a lot of videos
yes,
on
they
this.
are prescription hearing aids. Costco does employ audiologists and hearing instrument specialists. Both of them are licensed in their particular states to be able to dispense prescriptive level hearing aids.
Mm-hmm.
Okay, good. The next question that I have is kind of a story, but we're going to go through this.
Is it from my mother?
It is not from your mother, though I was monitoring to see if she was going to make a comment that you had mentioned her, because officially she is now famous.
Yeah.
Yes. Yes.
But this person writes in, I got a set of hearing aids, top of the line, and I still don't understand what people are saying. It's not that I can't hear them, it's that I can't understand what they're saying. It really gets my wife, expletive, mad at me, because I'm always saying, what are your suggestions?
Oh, goodness. Okay, so this there's a couple of things here. So without seeing the audiogram, we don't know the type or the severity of the hearing loss there. So it's hard to make comments on exactly what's happening without knowing exactly what's happening. But there's probably a strong case for the fact that the hearing aids very likely may not be programmed correctly or just been verified of what the settings are. And I see this a lot, and we see a lot of patients that come into clinic. They say the same exact thing. They walk in and they go, I've spent all this money on these hearing aids and they're not doing what I need them to do. And most of the time, they've got the technology that they need. They just needed us. And so it's sad because there's a lot of providers out there that will not follow those best practices. But if you can find a provider that follows best practices, you cannot end up in that situation, because we are meeting with you so frequently and we are verifying things so often that your performance is essentially insured at that point.
You know, I think the other problem with this, in this particular, not a problem with the comments or where it's coming from, but I think the problem is that even if the provider did follow comprehensive best practices, because it is possible that they did. In fact, this could be one of our patients that did, right, from a best practices standpoint. The problem would be is that when best practices were being followed, it wasn't being explained to the patient along the way, so they actually understood what their outcome should be. So anytime I hear a question like that, I'm like, well, what did the validation outcome measures say? What was the hearing test? What did the provider indicate to you in terms of capabilities of even being able to treat your hearing loss? This individual might be more of a candidate for a cochlear implant too. Like, we don't know without the data, but a patient should walk away with hearing treatment and understand, at least from a foundational standpoint, everything that's going on. And they should know, am I at my maximum performance with my residual hearing ability with these devices? And if they don't know that, that's the biggest problem out of all of this. And this is often the thing that I care about most in the clinic, is that it is not good enough to just follow best practices. You have to educate someone along the way while you're doing it so they are empowered. Because if I end up, I don't know, getting struck by lightning tomorrow, they need to understand what's going on with their hearing treatment so they could go to somebody else and make sure that they are getting a proper level of treatment.
Right. Education and realistic expectations are huge.
Absolutely. The next question that I have coming from our Facebook is, what if my provider didn't do all of the hearing tests that we had shown on the audiogram, but they still gave me hearing aids?
So from that perspective, everything that we showed on that audiogram wouldn't necessarily be mandatory to do based on what the patient is reporting when they come in, and based on a test that we had done. So everything's progressive. We start off with a certain part of the hearing test, and then based on that, we move on to the next thing. Based on that, we move to the next thing. And if we have an outcome and we're like, we don't need to do this additional test because nothing has shown us that we need to do it, then we don't do it. Right. And so if you're going in with the expectation that a certain test should be done, and there's certain foundational ones that should be done, but not everything. So, you know, tympanometry doesn't necessarily have to be done every time. If it's not being indicated based on their reporting, if it's not being indicated based on an air bone gap, which is a technical term, I get it. I do think I have a video on that, so you can look that up. But if it doesn't call for doing an additional test, then that additional test, if they do that without having necessity for it, the question is, was that worth your money to even have that part of the test done?
Right.
Yeah. I think, and that's something that you can just ask your provider too. I think many times patients do a lot of internet research, right? And they end up and they find this list of things that maybe someone online says that they should have done during their appointment. And sometimes if you just ask your provider, you know, should I have this test done? And see what their response is. If they just say, no, that's not a good answer.
Right.
They should say no, and here's exactly why you don't need this test done. Here's what you're giving me clinically that tells me that we've got enough of what we need here. And if you still want to push it, your provider should be able to hand you off to someone that has the equipment to do it or that's willing to do it.
Yeah, as long as you're willing to pay for it.
As long as you're willing to pay for that
I'll tell you this,
yeah.
If you are using your insurance and the insurance company is saying, well, you can't do that test and have us pay for it unless it's medically necessary, guess who's paying for it? You're paying for it as the patient, right?
Yeah, so a lot of factors in that one, but still a great question.
That was a fantastic question,
yeah.
for sure.
A lot to talk about and to dive into with that one. I have one more. Will hearing aids make my hearing worse? And I know that we've been asked that a couple of times just this week, so I know that you both have some pretty good answers to this one.
It's a pretty loaded question. So I'm going to just start off by saying no. Most of the time, no. We get into a tricky situation when patients do have severe to profound hearing losses where the output of the hearing aid does need to be higher than what would be considered technically safe levels for long-term exposure. Now, those instruments must be fit by a hearing healthcare professional, and there are warnings all over in the software and on the boxes. Hey, these hearing instruments exceed 132 dB SPL, and they need to be fit with care. And they are fit with care by professionals who know how to program them accordingly. Most hearing aids, and I'd say a vast majority of hearing aids, will be programmed in a way that there should be no impact on your hearing at all. Do you agree with that?
I agree, and it comes down to probability versus possibility, right? It is possible to damage your hearing by the use of hearing aids. It is not probable, right? Unless you're going to a completely incompetent hearing care professional who doesn't know what they're doing, right? Which probably exists. I don't know if I've ever met one in person who would be that bad, right? But I don't want to say nobody. Okay. I think one perception that a lot of people have, and again, I hate to plug my own videos all the time, but I'm doing it all the time, but I have a video talking about this because I had a patient who brought it up. And it's because when, at the end of the day, after she went through a full adaptation period with her devices, she took them out of her ears, and she's like, I think my hearing is worse than before I got these hearing aids. And it wasn't that. It was that her brain had actually changed. So when Dr. Alturi with the Hearing Up Spotlight today was talking about how individuals, their brain changes when you have untreated hearing loss, when you start to change the brain back to the way it should be, your brain gets used to having that sound again. And then when you take it away in an instant by pulling those hearing aids out of your ears, it makes you feel like your hearing loss has gotten worse.
It's like turning the lights off. Yeah. I've heard that one too. And I always have to say, no, your hearing is exactly the same. You just love your hearing aids. They're doing what they need to be doing. They're stimulating the auditory system in the exact way that they're supposed to be. And that is why they feel so effective when you put them on, and you definitely notice when you take them off.
Absolutely. Another fantastic question, of course. Kelsey, thank you so much for sharing those questions with us again today. That pretty much wraps it up for today, talking about prescriptive level hearing aids. I think next week we're talking about kind of comparing different aspects of prescription with over-the-counter, since over-the-counter is a hot topic right now. People are searching for information on that. We want to make sure that you have accurate information, not just information when it comes to OTC, as well as prescriptive level hearing aids, because there's a lot of speculation that's going on out there right now. But as you guys know, if you're watching this right now, you can find us on Facebook Live, you can find us on YouTube Live, you can find us on WTSMTV.com to watch us on the live show, or you can actually, if you can't make the live show, make sure that you tune in after these live shows get rendered and published for long-term viewer capability, okay? Be patient with us on the closed captions. We do get every video custom closed captioned after we post it. Just be patient because it does take time to get those custom closed captions going. But thank you guys so much for joining us this week. It's been an absolute blast. Keep those questions coming. And as always, we'll see you next week.